Welcome to the second part of Hospital of the Future, where we discuss about the outpatient department. This is about the flexible consultation and treatment rooms. When I started my practice as a neurologist in 1996, there were a very handful of neurologists in our city, and each hospital had only one specialist or a neurologist. And over the years, now each hospital has got at least 6 to 8 consultants. So each doctor having an office in a hospital, the hospitals find it extremely difficult and impossible to accommodate or have rooms for each doctor or an office for each doctor. In the future, outpatient consultation rooms will be far more than just spaces for routine checkup. They will serve as multifunctional treatment rooms equipped to handle various medical needs, ranging from basic consultations to urgent interventions. So these are not doctors' offices anymore. These are treatment rooms or clinical examination rooms. These rooms will feature examination facilities, real-time monitoring tools, and telemedicine screens providing flexibility in patient care. One of the essential innovations in the system is the role of physician assistant, who will in the future, I'm pretty sure that, will act as a clinical digital assistant. I'll explain the scenario. When a patient enters a room in the future hospital, the physician assistant, who is digitally trained, will take charge of the pre-consultation tasks, such as recording the vital signs, gathering all the medical history, the details, and conducting the initial evaluation of the reports available. And all these are fed into the computer using AI-powered clinical decision support software and assisted by a voice-to-text dictation. The assistant will be able to create an AI-suggested care plan based on the patient's data. So by the time the doctor arrives, the groundwork is already done. Just imagine that. This system increases efficiency by ensuring that everything is ready for the doctor to make quick, informed decisions. He doesn't have to go through all the reports. Everything is neatly arranged, analyzed by an AI algorithm, and a decision plan or a treatment plan is in front of you. The doctor's time is focused purely on patient's medical needs rather than on administrative or preparatory tasks. Many a times now doctors spend quite a lot of time just collecting all the reports, arranging it in order and looking at them. Vital signs, initial tests, and AI suggested care plan will already be in place, meaning the doctor can review the patient's information and immediately proceed with the diagnosis and treatment. This will make the doctor a doctor in the real sense, humane, spending time with actually talking to the patient and consoling the patient and charting out a treatment plan. Doctors will also be able to rotate through multiple rooms because they need not be confined to one room. These are clinical exam rooms moving swiftly from one patient to the other. This setup significantly improves room utilization as doctors won't be anchored to a single room. These are all clinical examination rooms. Instead, once they finish with one patient, they can move to the next room where the physician assistant already has prepared the next patient's records and assessments. This also leads to better utilization of the patient's time. That's why it is patient-centric. They don't have to impatiently wait for the doctor to come or for the next turn. The physician assistants will review their details, and this allows for a steady flow of consultations, maximizing the use of each space and reducing patient waiting times. Moreover, in cases where a patient needs urgent attention, such as if they fall in the waiting area, if they deteriorate in the waiting area, they fall sick in the waiting area, somebody collapses in the waiting area, all this happens quite frequently. The consultation rooms or the treatment rooms are equipped to handle immediate treatments. They can be given injections, they can have resuscitations, or even emergency stabilizations can happen directly in the room. And these rooms also can serve as a temporary holding area where the patient need not be shifted to the emergency or somewhere else for treatment, but the patients can remain under observation until they are stable enough to be transferred to a more comfortable location. While the patient is being stabilized or treated, an IV injection is given, he is monitored, the doctor can continue seeing other patients in the adjacent treatment rooms. So this concept of clinical exam rooms will definitely help, and because thanks to the support of physician assistants, this system ensures that care is provided seamlessly and efficiently, and no patient is left waiting unnecessarily. The real advantages of the system are extremely clear. It provides this type of consultation rooms or clinical exam rooms provides immediate care for those in need, something like an urgent care, keeps the doctors focused on medical decisions rather than on paperwork or collecting the investigations, and ensures that the hospitals maximize the utilization of their spaces, because space is extremely expensive now. This integrated tech-enabled approach will lead to better patient outcomes, quicker treatment times, and a more streamlined patient experience in the outpatient department. And please do share your thoughts, your comments, and if you have any alternate suggestions on this, let us work together regarding developing or designing or planning hospitals of the future.